Right, there is a rather upset bear with Nigel and the skull of no hope. Right, we're out of here. We are heading for the hospital. I shall be at the hospital. And once again, it was a very clear run. Half an hour. So I'm way early. I shall be waiting for half an hour and then, whoops. It's almost filming a crash here. The car park's very full. They're doing good business.
We met previously at the beginning.
We did.
Yeah, come on in.
Thank you very much. Thank you for seeing me.
How have things been?
Improved.
Wonderful.
Yeah.
And you never really had huge number of symptoms. It was more productive cough, wasn't it? And
The sputum production has reduced dramatically, and I'm now able to actually get a bit of sleep as well.
You were getting drenched with sweats and things when we first met.
I'm still having a bit of an issue with temperature regulation. I'm often ringing. Absolutely ringing.
Right.
Not so much at night,
Yeah.
because I'm actually sleeping a good 6-7 hours now because I'm not waking up with all the coughing and stuff.
Because you came you've been referred to the cancer clinic, really, as well.
Yeah. I thought I was gone. I thought I was gone.
And we talked, and we thought it's probably more infective, but we need to do the bronchoscopy, which you had. It didn't really do anything, and we did all the blood tests that we were looking into to try and find out what was going on.
Has anything come back with the bloods?
So the blood test is the reason that Dr. Rollins started you on the voriconazole medication, or the antifungal.
So it was an actual positive for aspergillosis, yes?
Yeah. So we were asking you about lung disease. It's one of the things that we'll get very confused about.
Okay.
You get lots of, it is as a spectrum, and depending on how your immune system's responding to the aspergillus. Some people get more of an asthma-y, allergic-y type picture.
Right.
Some of those people also get a semi-invasive or a chronic pneumonia-like picture, which is what you're
with the cavitation, yes.
And then some people generally are haematology patients who are on lots of chemotherapy, get a much more severe, more invasive, high fevers in hospital.
They already have a compromised immune system.
Correct.
This is one of my questions. Why have I been hit by this?
Everyone's different, and everyone responds funnily to it. And
right, the cavitation, is that caused by the aspergillosis or the other way around?
No, that way around, yeah.
Oh, right, okay. Yeah. So the aspergillosis has caused this big hole in the...
It's like a... I'm not going to say chronic, because that can be interpreted in different ways, but a pneumonia. So rather than a pneumonia where you get sick, you end up in hospital, has some antibiotics and go home, you've had more of a slower onset of pneumonia, doing some slower onset of lung damage, but significant lung damage that we're now treating. And because it's a slower onset process, we need to treat it slower with a longer course of treatment.
Right.
In your case, antifungals, the voriconazole.
I've got 1 day left. I'll need a repeat.
Yeah.
Okay.
Yeah.
Right. What caused the extensive cavitation? Well, you've answered that. That was the aspergillosis.
Yeah.
I asked what type, but you can't really say.
So we haven't ever grown, when we did the camera test, we didn't grow a specific Aspergillus fumigatus or anything like that, which is the most common.
Right. Okay.
And you've got a combination of an allergic component as well as an infective component.
Right.
Some people only have the allergic, some people only have the infective, and you're in the middle group where you get a bit of both. And they're both measures of your body's mounting an allergic reaction to the Aspergillus that you're breathing in, that has become semi-invasive, giving you the cavitation.
Okay. What causes and what is the significance of enlarged mediastinal lymph nodes?
So lymph, yeah.
I've looked up where they are. They're kind of in the middle here
There's
somewhere.
lymph glands surrounding the windpipe and things, yeah.
What's the significance? What is the cause of having enlarged lymph nodes?
So our lymph glands are there to help. It's where the lymph glands go, so our white blood cells go when they've been fighting off infection and whatever.
So a big fight of infection would enlarge them, they just overreact a bit.
Correct.
Okay, happy with that?
Yeah. And we'll need to repeat your CT scan to check that as the infection gets better, the lymph nodes go away, to check they don't need further investigation.
Right.
The fact that they're confined to the region where you've got active infection and inflammation means that we're quite reassured that we don't need to go sticking biopsy needles into the lymph nodes at this stage.
The cavitation, if we're successful with the antifungal medications,
Yeah.
I gather another 2 months potentially.
Yeah.
I've done a
The
month
duration
now.
is tricky.
Is it normal that you do a course and ultimately stop, and then you have treated, or is this liable to be a reoccurring, will I repeatedly suffer the sort of infection that I just survived?
Good question.
Especially with that level of
The
cavitation.
duration
now.
of treatment is really tricky, and because it's not the most common thing we see, the duration of treatment is a bit how long's a piece of string kind of thing. We say 3 months, and that's probably a minimum.
Can I ask, how common is what I'm presenting?
Good question.
Because I'm a smoker, I'm assuming that you may have, or is it a little bit rarer?
We don't have a queue of people with similar problems lining up in the waiting room.
Right.
There's a range of people. We'll see each consultant may have 2 or 3 or 4 different patients with similar conditions of similar Aspergillus related problems on their clinic load, for example.
Okay.
Maybe half a dozen depending in a general respiratory hospital. One of our colleagues in Plymouth has done her PhD at the National Aspergillus Centre, which exists, which is in Manchester.
I'm aware of that.
And so we may take advice from her.
Right.
Depending on how things respond and how things go. If it's all going very smooth, it makes it very simple, and we can just go with the status quo. If things aren't quite progressing, or we're not sure how you're looking in terms of when to stop treatments or any other treatments to add in and whatnot, then we might speak to her at some point.
Okay, so it is possible that I may re-encounter such infections even if I get over this one.
Yeah.
Okay.
What we can't tell is,
I may now be susceptible.
yeah, and you may get secondary bacterial infections in there. You may be at risk of getting further infections down the line.
In terms of my actual breathlessness, if you will.
Has that improved?
Not really, actually.
And have we done breathing tests with you yet?
Have you done what?
Blowing tests, breathing tests, around the corner in our physiology lab?
No.
Fine. So that's probably our next step, now that we don't think you've got TB or anything else that makes us not want to do that. We could take a form round in a minute and see if they can slot you in. The inhaler your GP would have given you would have been just a try and see.
Right.
What I'd be suggesting was you'd give you something that manages things like COPD, which is common in people who've smoked for a long period of time or have got damaged lungs for other reasons on top of that.
Right.
And it may be that might help with the breathlessness going forwards in the longer term. Would you mind if I dropped a line to our ophthalmology colleagues just to do a detailed eye visual assessment? Would that be all right, just to make sure that there's nothing else going on? What we don't want to do is to have a minor problem that we leave for a month and then it becomes a bigger problem.
Okay.
Would that be all right?
Okay.
I suspect it's nothing, but just so at least we've got a baseline so we know where to go if anything changes down the line. Is that all right?
Yep.
They are based in the hospital here.
Good.
I'll ask them to contact you.
Okay.
Yeah.
Okay.
Good. Now, things we need to do today. I request the breathing test. I doubt that they've got space to slot you in today, but I can ask the question. We need to do a chest X-ray to see how you're looking. It's a little bit on since your last imaging, isn't it? So
is it likely then that, certainly we've been checking this with the X-ray, I presume, is it likely that if we get on top of the aspergillosis, the cavitation will
hopefully
stop?
down.
It'll just remain as is?
I'm hoping to see some improvement. The chest X-ray, and as I say, we need to repeat your CT scan at some point. It could be that there's a bit of inflammation that's sort of starting to resolve around the edge of the lining of the lung, which is pretty sensitive.
Okay.
I'll be interested to see your chest X-ray and see how things are looking. How much phlegm are you coughing up?
Not so much. Quite frankly, not so much. It's most noticeable, perhaps, with a very full nasal cavities in the morning, and having to cough quite a bit in the morning.
Yeah.
But other than that, dramatic improvement.
Good. And how's your appetite?
Better.
Good.
I dare to even
You've put on half a
think
stone.
I may have put on some weight. Yes, I have, haven't I?
Yeah.
I've been trying to eat more deliberately.
Good.
The voriconazole, or whatever it's called, that seemed to act like one would have imagined an antibiotic would react.
It's doing the same job.
Within 3 days, bang, I
Brilliant.
was dramatically different. I was able to sleep a bit more, and I'm where I am now, I'm better-ish.
Good. That's really good to hear.
Thank you.
Suggests we're on the right track.
Yes, thank you.
Blood test form, X-ray form. We're
Right.
going to find a prescription for you for the voriconazole. If you're okay and it seems to be working, we'll box on with the same dose.
Okay, yeah.
Duration, I don't know. I'll just give you another prescription for a month.
Good.
And we should probably I'll put 6 weeks on there. They might be able to issue you with 6 weeks, but just going to try and follow you up in about a month. It gives us a bit of leeway.
Yes, it was a bit fine today. It's
Yeah,
I've got
we've
one
got
day
as to
left.
exactly when he wants to follow you up. Good. I hope that answers your questions from today.
I think it has, yes, indeed. Thank you.
As I say, we'll need to repeat your CT scan at some point. Fine. So you're on 200 milligrams twice a day, is that right?
Yes. Right, X-ray's done. Oh, I am heading for the pharmacy before I do the bloods. I think that makes sense, because the pharmacy will take a while. Right, that was the prescription. I'm getting run over. That was the prescription put in. We were happy with that, so back into outpatient. Yeah, this is good time management. I like this. Bloods are done. Very quick. Right, let's see if my drugs are ready. It's probably too quick. Right, we're out, but we're a box short. They will be in touch and hopefully arrange a delivery, allegedly. That's a bit disappointing. Anyway, back to the car. Right, how's this going to work? Right, please insert ticket. Well, that way. That's the ticket inserted. And keep doing. How do I pay? What's it doing? I'll put my pin in. Didn't have to do that last time, did I? Pin okay. Approved, and there's my ticket. Right, we're out of here. There's the 8-hanger bike. Quick shot of the 8-hangers. Right, let's give Nigel a quick call and tell him we're on our way, so he knows where he stands. It's 10 to 4. Oh, thank goodness, I am back home. It is that. It's about 4:24 because yes, I've made the clock more accurate, and it's about 9 degrees C out here. We are home. We shall go and see what Bear's going to make of it. Being welcomed at the gate, am I? Hello, Bear. Yeah, I'm pleased to see you too. Yes, go on. Let's go in. Let's go in. Are you pleased to see me? I think so. Go on. Good boy. Good dog. Oh, go on. Don't go and wreck me. Yes, all right. Even though jumping up. Good boy. I'm back. Oh dear.
Oh, there you go.
Keep taking the tablets.
Yeah, well, you knew that was going to happen.
That was it, really.
Yeah. Did you have an X-ray or?
I did, yes.
Yes.
Right, let me.
Yeah, get yourself in.
Yeah. Put a kettle on. Oh dear. Yeah, all right. Smash the place up there. Yeah, all right.